Hi there. This is Dr. Ashab. I am MD Arif Ashab. I am a GP trainee in my second extension of my SC3 in Newcastle area in Northeast Dinnery. I sat for my SCA in May, so I'd rather talk about my failure first to let people know how this academy helped me. So I sat for May in my first attempt and I failed by 2 marks. And they say failure is the pillar of success. But to be honest, for me, it was obviously I broke down and then I found about Imtyiaz Academy. I took their course, their SCA course. It kind of helped me along with the IPS management course. And I sat in October again, and this time I passed, luckily, not by margin, but obviously by a good marks. And this course is all about not only it's not about it's not going to give you exact cases what you're going to have in the exam. Rather, it gives you it makes you a better GP by talking about different cases we come across in the GP practice, in our training, in our real life. And the IPS course, basically, that's a huge help for us, because when we IMGs, we are coming from abroad, we are not really sure how to talk as a GP, how to make a patient-centered consultation, the cracks and everything. So when I took the IPS course by Imtyiaz Academy, I figured out how to make it patient-centered, how to talk, and then based on that, I created a structure of my own and I started preparation. Now, speaking of preparation, if you ask me how to prepare or how long to prepare, is basically like finding happiness in your life. Some people keep searching for happiness for their whole life and they don't find it, and some people find it easily within years. So if you have the right direction, it can be only 3 months, which is more than enough. So for me, it was 1 year, but technically with Imtyiaz Academy, it was 3 months for me. And how I worked is, after the IPS course, I had a structure of my own that mentors, instructors of Imtyiaz Academy really helped me. And I had the structure. I made a structure of my own based on their instructions, and I kind of ran through the structure in my head every day when I was driving to work. And after reaching work, I used to write down the structure on a white piece of paper before starting my clinic. And I always try to see at least one patient who's coming with a first time presentation in a SCA pattern. Obviously, I understand it's not possible to see all the patient as SCA, but at least one patient. And also, one of my supervisors taught me that you don't have to see all the patients. You can't see all the patients in your practice in SCA pattern, but what you can do, even if it's a difficult patient, you can do the management part in SCA style, if that makes sense. So that's how I kept preparing. And the day I was off, I made sure that I am at least practicing one case every day, be it seeing a patient or be it practicing with my partner. Now, speaking of partner, it's really important to find a good practice partner, but we never know who's gonna click for us. So best option is trying with different people and see who works. And in terms of the reason for practicing is, for these 3 months when I was running the structure in my head every day, it was kind of giving me the flexibility to use the structure around the consultation, because that's really important, so that the consultation is more like a conversational rather than a doctor-centered consultation. And for that, the IPS management course of Imtyiaz Academy and the course itself, the course material, the system-wise approach, the system-wise management based on up-to-date NICE guidelines was spot on. Thank you. I am done.